So we are actually getting a lot of questions. Do you guys want to start answering and addressing some of them?
Yes, absolutely.
We can all kind of go through and pick and see. I'll ask this question. Maybe, Salima, you can answer this, and same with Kumkum. So people are asking about like different tests for food sensitivities. Like, what about stool testing? Like, I see these advertised all the time, and patients come in saying, there's a stool test. It's going to tell me my food sensitivity or allergy. So what's your thought on that? Should people spend money on that, or?
Yes, I am here to say don't spend your money on it, okay? So there are so many types of testing out there. I mean, I was just at the supermarket, and I was like, for $100 and something, send in a sample, I don't know, with your hair or what it was. And don't mail order, sample, anything. Don't do it, because none of these are validated. They're not peer-reviewed. So there's no accuracy. There's no predictability with it. They don't, most of the data that they've published are like in non-peer-reviewed journals. And so there's no evidence backing up what they're doing, right? So going back, and I've heard of the stool testing. I've heard of like kinesiology, where they'll have you hold a certain food and then they'll test your muscle strength. I've heard of hair, urine, stool sampling. The biggest one, I think, is the IgG one, where people are like, there's panels of like 90 to 100 food sensitivities that they're doing at one time. And it sounds so inviting and so wonderful. And, and I get it, because every patient is so desperate to find an answer, right? Like, to say it's my stress or like something going on internally is just so much harder to deal with. And you would much rather blame it on a food, right? And I get that, right? So when patients come in and they come in with these pages and they're pretty colorful, right? Like 10 pages of stuff that had food sensitivity testing on. I have to really go back and I say, I'm really sorry, that this doesn't show us anything. And in fact, IgG is a memory antibody, right? And so once you've been exposed to a food, we all will produce IgG, right? And so when we're doing things like, if you're allergic to cat and I'm giving you allergy shots, all of the data why allergy shots even work is because you're decreasing the IgE and increasing that IgG, right? So of course you're going to find IgG going around because we're eating all these foods. So there is no validity in any of these testing. And so I would say save your money. There are many other ways that we can all spend our money, but some of these tests are not that. And, obviously talk to your doctor, get a referral to an allergist. I mean, a bulk of my job is to do just that, explain to the patient, And like I said, most patients, once they walk into my office at first and they're just excited, they want to get their skin testing done, then they're disappointed, but then they come back and like fully understand, okay, this is what's happening, And I think it's just having that conversation. And so, don't waste your money on it.
I love it. Thank you.
Great. I totally agree with you. There's no good research on it, so I don't recommend it either.
Yay.
So we're getting a question. Maybe you want to answer this. Why do you think there's not enough awareness about celiac disease in the South Asian community?
Ooh, that's tough, because I think people just associate celiac disease to be one for Caucasians, specifically ones from like Norway, Sweden, things like that. And so they say, oh, you know what, I must not have it. Same thing with inflammatory bowel disease. They are convinced that Crohn's and ulcerative colitis just can't happen to us. And so they're like, well, that's not it. It must be the rice I'm eating, or it must be the whatever. My mom had it. My grandmother had it. My great-grandmother had it, never saw a doctor, but I'm convinced that it's the same thing that she had. But no one's actually tested for it. And so it's very important before we say that it's an intolerance or it's some kind of other disease, that something as serious as Crohn's and ulcerative colitis, which can predispose you to colon cancer, is actually first ruled out. That's the most important thing. You got to rule out things that can lead to cancers.
Yeah, that's so true. And we are seeing it more and more. And I think the more we talk about celiac disease and there's more of an awareness, and more people think, okay, maybe I should even go see a doctor and get tested. Like, people might not even go talk to their provider. Okay, there's another question. It says, also, many of my family members, when they came from India to the U.S., they developed food allergies. Why do you think that is? They never had those food allergies when they were in India. So I can start with that, and then you guys can add to that. So I think this is actually really interesting, because Me and my sister, we are allergic to tree nuts. And nobody else, like in my family, my parents, my grandparents, like nobody has any food allergies. So they always thought we were making it up. And they were like, oh, you don't have a food allergy. And I actually feel like a lot of people in the Indian community don't even believe in food allergies. Like anytime I go to an Indian restaurant and I'm allergic to tree nuts, and like I'll ask them 1,000 times, like, is there like any like almonds or walnuts? Like they're like, oh no, there's nothing like that in there. And then I get an allergy and I get an allergic reaction. So I think it's interesting. Yeah, my family didn't believe we had it because they had never seen it. They were like, nobody had it. And so I, think that it has a lot to do with our environment and our diet. And there is something called the hygiene hypothesis. And maybe in America, and I'd love to know, like, Selima's thought as an allergist about this, but like, maybe we are too hygienic and like we're all using too much like soap and antibacterial stuff, and we're not getting exposed to like dirt and, all different things as a young kid. And getting that exposure actually might be protective to our gut microbiome and help our gut health. So I actually do think there is something to that hygiene hypothesis. And so, when I started learning about gut health, I started learning about it when I was pregnant with my first daughter, because I started to research. I was like, well, what can I do to try and help her out? And so I actually initially was using a lot of like hand sanitizers, and then, I said, okay, let's not use hand sanitizers for everything. Or if like a toy falls on the floor and she puts it in her mouth, like that's good for her gut health. Like,
let her eat dirt. Let her eat some dirt.
So I think that we're also probably eating a lot more processed foods than, people were, 50, 100 years ago. And that does affect our gut microbiome. So I think it does have a lot to do with, the foods we're eating in our environment. And also I think in the young age, like those first few years of life are really important in like developing a healthy immune system. And that could kind of be a talk for, another hour, like what do we do in those first few years of life? But I think, that's really important. And I know Selima and I talked, I've done something really bad, which is, so I'm allergic to nuts. My sister's allergic to nuts. My oldest daughter is. So then I freaked out and I haven't given my younger daughter any nuts, and she's now 4. And Selima was like, that's like the wrong thing to do. You're supposed to. I'm like, I know. I just don't want to see her have this reaction. So maybe Selima, you can talk about.
Yeah, absolutely. And I do believe in the hygiene hypothesis and this idea of, when we're born skewed towards what we call a Th2, which is the allergy-driven response slightly. So in order for us to activate that Th1 response and shift things to a non-allergic pathway, we do need to be exposed to viruses and endotoxins. And so there's a whole role of just like epigenetics that's really important here. And they've studied some of this. And if you look at the Western world, there's also like a high rate of C-sections in the Western world, right? So that gut microbiome does play a role, right? So when you go through the vaginal birth canal, very dirty, right? We're literally pooping on our children, right? And when you go from having a C-section, you're going from the sterile glove into the sterile incubator, right? So they've also looked at antibiotic use, like when a mother is delivering, does she get antibiotics? Because that impacts the infant's gut microbiome. Or there was another study looking at the first 3 months of life, and did the infant get antibiotics? We're also looking at, like you said, processed foods, right? So in China, per capita, they actually consume more peanuts than we do, but they consume it in like a boiled form versus we're opening up, the peanut butter in a jar, which has been highly processed, very resistant, right, to being broken down. And so then our body is now wanting to attack it. So it is multifactorial. I really wish I had the answer to all of it, but it's layers of stuff that sort of go into play. And I've been the same way, Sarina. I like with my kids, when they were younger, if they dropped their pacifier or something on the floor, I would be like, okay, here you go. It is what it is, like it's all good for you.
That's stressful as a parent too. It's like a win-win situation.
Absolutely, yeah.
I stopped sterilizing things for my second child, and I'm like, all right, here you go, second child. Also, I'm probably not as careful as I was with my first child. I'm like, all right, here you go, pacifier dropped 4 times, done, take it. One of the things I do want to touch on, though, and I got some DMs about this, and was hormones, pregnancy, and PCOS. A lot of South Asian women have polycystic ovarian syndrome. A lot of women have thyroid issues and constipation. And during pregnancy, either these symptoms are exacerbated or worsened. And so I just quickly want to touch on, I'm sure we can do another live session at some point, but I do want to touch on that. Hormones like progesterone, which is the primary one when you are pregnant, will cause bloating. Okay, it basically causes your gut to slow down because it needs to allow for a few things to happen. One, for your baby to grow. 2, it needs for basically the way to loosen up your muscles. So progesterone is causing for the muscles in your food pipe, your esophagus to slow down, and that affects transit. Okay, so when you're constipated while pregnant, that has to do with hormones. If you have hypothyroidism, you have thyroid disorders, make sure that is checked by your doctor. Make sure you're seeing an endocrinologist. And, and if it is low, that may be contributing to your constipation. If it's really high or your dosage of your thyroid medication is excessively high, you may be having diarrhea, and it may not actually be that it's something you're eating. It might just be that medication. So I've gotten a few DMs from people saying, I have PCOS, where you get insulin resistance, you have a hormonal imbalance, and you may have infertility and trouble getting pregnant. And so all those things combined can really affect your gut health. So it's very important that you let your gastroenterologist know if you have a history of these things and if it is kind of affecting your gut and your bowel movements.
That's great, Kumkum. We're also getting a lot of questions about what kind of doctors should you see for bloating or acid reflux and Gerd. Someone else said, I got a lot of gastritis or reflux during my period, suggestions. So that's something we didn't talk about yet. You want to talk a little bit about acid reflux? Because it's definitely really common in South Asian women.
Yeah, I mean, being in the South Asian community, you hear about aunties being like, oh, I have acid, I have acidity. And I'm like, okay, but what does that mean? Are you burping? Are you belching? Are you having abdominal pain? Like, are you actually feeling like a burning acid sensation? And sometimes it's one, the other, or not at all. And, a lot of people don't know what that means. One, you need to make sure that you don't have what we call an ulcer in your stomach, okay? You may be having pain from that. And 2, and you get something called an endoscopy, where a camera is taken down and you look to see if there is an actual, a destruction in the lining of your stomach or in the food pipe itself that's causing it. Second, because of hormones like progesterone, or because over time you've gained a lot of weight, the muscles in your food pipe have gotten loose. And when these muscles have gotten loose, they allow for a lot of acid to kind of reflux and come up into your food pipe. So throughout the day, you're burping a lot. You're feeling this burning sensation and you're feeling poorly. And then sometimes you're just drinking peppermint, chai, all these herbal things that your grandmother has told you, and it's not helping. And that may be because the underlying issue needs to be solved. And so if that's what's going on, then you need to see a gastroenterologist, one, to make sure that you don't have a bacteria called H. pylori that, is going on. Or if you do have a lot of reflux, check out and see whether or not there's something more pathological, or if this is, something that is coming from stress, because you can have that as well.
That's really great. And then one thing, too, that we can just mention is that caffeine can also sometimes increase reflux. And we know a lot of us South Asians like to have a lot of chai. So just be careful if there's a lot of caffeine in that, that's going to make your reflux worse. We actually got a few questions or thoughts. Someone said, my mom always talks about ajwain or caraway seeds for bloating thoughts. And someone else said that they also take ajwain. So I think that this is really interesting. I love it. My mom always talks about ajwain. What do you think? And I only know about ajwain because my mom talked about it. So after I gave birth, my mom would make me ajwain water, boil up water, put ajwain in it. And he was like, you need to take this like after birth because it's going to help like bloating, gas, and all these things. So, I mean, I think it's great to take. I think it is healthy, and it's definitely a great way to help with bloating and gas. So I think it's, all of these things that our like South Asian parents have talked about and like our grandparents, like they probably just did this stuff and things were passed on from generation to generation that like, oh, you have, constipation, you take Thrifla, like you have reflux, you take ajwain or you take salt after meals. Like, like now, at least for me, like I now have an interest in this field, so I'm learning about it, and you're realizing that all those things that our parents and grandparents were doing is like so accurate and true. And when you read about it, you're like, this is actually a really great natural way to help a lot of these symptoms. So I think, if somebody says my mom always talks about this, it's like definitely a good idea to look into it because it might be right and actually have some health benefits.
No, definitely. I've been having the fennel water, and even I went too. I gave birth not too long ago, and I have had I don't even know how many cups of ajwain water. Someone just asked a question: what's the significance of a bad taste in your mouth? Is it GERD? It very well could be. If you feel like there's a metallic taste or a sour taste in your mouth, that could really be the acid coming up from your stomach, up the food pipe, and coming up all the way up to your mouth. If you feel like you have that or you're coughing, even though it's not, an allergy or it's not cold outside or you don't have an actual cold and it's worse at night, perhaps maybe you might have a lot of actual acid reflux that's happening. And if that's true, you should see a gastroenterologist.
Yeah. And also one thing too with reflux, like it can be acid reflux, or if you have irritation in your throat area, some people might have sinus infections or postnasal drip, or even allergies can actually cause some irritation in that area.
Yes.
Unrelated to the allergies we talked about.
I think our time is actually, we're up. It's
all right. Well,
yeah.
This has been fantastic, girls. I have absolutely loved being on this panel with you guys. This is just day 2 of the South Asian Wellness and Health Summit. So tune in tomorrow starting at 11 a.m. Eastern Standard Time. And make sure you find us on social media. You tag us. Use the hashtag SAWAHS. And Sarina, where can we find you if we want to look you up?
You can find me Doc Sarina, so DAOC, and then I'm SARINA. And you can find me on Instagram, Facebook, or DocSarina.com on my website.
Amazing. What about you, Salima? Where can we find you?
You can find me on Instagram, Dr. Salima.
Awesome. And if you have any gut motility questions, I'm on dr.gut_motility. Also, you can just find me by my name, Patel. All right. Thank you, everybody, and we'll see you soon. Take care.
Bye.